Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering Fundamentals Aging Adult Part 2. So if you haven't watched Part 1 already, please make sure you do so. You don't have to watch it in order. The questions don't go in order, but this is very important information. Make sure you guys watch both parts of the series. If you haven't done so already, please be sure to like and subscribe below. Make sure you press that notification button so every time a new video is released, you'll be notified. And as always, guys, if you appreciate these videos, please support my channel by sharing this content. All right, guys, so let's get started. First question. The nurse is presenting an information session on nutritional guidelines at a senior living center. Incorporated into the discussion are the recommendations for nutritional intake for individuals of this group, which would include a reduction in A, fiber, B, protein, C, vitamin A, or D, refined sugars. And I'll give you a moment to think of your answer. If you're new to this channel, go ahead and just press the pause button. And when you feel you're ready, you think you've come up with the right answer, just press play to resume. So the correct answer is D, 4, refined sugars, okay? Fiber. Especially elderly, they need lots of fiber. Why? Because the older adult already tends to have not drink enough fluid. They tend to be dehydrated, so the stool gets what? Hard, right? So they need plenty of fiber to make sure that they're able to go easy, right? And remember, another important thing about fiber pulls all of that crap that's been sitting in your vessels and in your gut, right? It pulls it all out. So when the patient has a BM, it all comes out. So they need to have lots of fiber. 2, protein. What's protein important for? Protein is important for muscle. Remember, the older adult, their muscle mass tends to decrease. The muscles get weaker. And another reason protein is important is for wound healing. And then choice 3, your vitamin A. Vitamin A, that's a fat-soluble vitamin, very important, good for vision. Vitamin A can be found in what? Lots of fruits and vegetables. So all of those things, the protein, the fiber, vitamin A, the older adult needs, right? But refined sugars, absolutely not. They don't need it, so they need to reduce that in their diet. Next question. The nurse is presenting an information session on nutritional guidelines at a senior living center. Which of the following foods meets a recommended nutritional guideline for older adults? 1, grilled chicken. 2, hamburger and french fries. 3, hot dog and dill pickle relish. Or 4, baked potato with cheese and bacon bits. And I'll give you a moment to think of your answer. And the correct answer is 1, grilled chicken. Why? Well, it's grilled, it's not fried, and that's a good thing because we don't want anything with lots of fat. We don't want anything to clog up their arteries. It's grilled, that's wonderful. And chicken, that's what? A protein, which is good for wound healing and it's good for the muscles. Wonderful. Let's go over the wrong answer choices. 2, hamburger and french fries. How are french fries made? They're fried, right? All of those fat and lipids, what does it do? It clogs the patient's arteries. We don't want that. Plus, it's high in sodium. Choice 3, hot dog with dill pickle relish. Hot dogs are high in sodium, and so I know pickles high in sodium. Relish, I don't even know what relish is. I think relish is a condiment. I'm not 100% sure, but if I'm right, it's a condiment. Guess what? That's high in sodium too. So that can't be the answer. And then your 4th choice, baked potato with cheese and bacon bits. Well, the baked potato, that's not too bad. Nothing wrong with that. But the bad part is the cheese. Cheese is high in what? Cholesterol. Clog your arteries. And bacon bits, high in what? Cholesterol. Also, besides cholesterol, cheese is also high in sodium as well, right? So, well, the packaged cheese, the kind that we normally put on, on our pizza, on a hamburger, baked potatoes, it's going to be high in sodium and it's high cholesterol. So all of those choices for the older adults, we don't want any, because let me tell you something. An older adult has been on this earth for a long time, so they've had decades to eat pizza and french fries and all of these fatty, greasy foods. And what does that fat and grease do? It sticks to the inner lining of the arteries of those vessels, clogs them up. gives the patient hypertension. So we don't need any of that. So the healthiest food choice here is the grilled chicken. The chicken is wonderful because it's protein and it's grilled. It's not fried. It's not dipped in that fat. In the assessment of older adult client, it's often difficult to discriminate between delirium and dementia. Delirium is characterized by a slow progression, 2, lasting months to years, 3, a normal state of alertness, or 4, occurrences at twilight or darkness. Okay, and the correct answer, guys, is number 4, occurrences at twilight or darkness. So let's talk about very shortly, because in part 1 of this video, I explained in detail the difference between delirium and dementia, and you have to know the difference between the two. So in this question, they're asking about delirium. So delirium is that short-term confusion, and you often see it in number 4, at twilight or darkness. So at nighttime, when it's dark, the patient can get confused, or just upon waking up, they just woke up from sleep and they might have an acute confusion. That's when we tend to see that quick onset of confusion. Let's look at our other choices. You have choice 1, a slow progression. That's dementia. Choice 2, lasting months to years. That's dementia. Choice 3, a normal state of alertness. We see that with dementia. Those patients with dementia, remember, dementia is chronic, it's gradual, it's insidious, it's progressive. As time goes on, it gets worse. But the thing is, those patients with dementia, they're alert. They're awake, they're alert, they're just confused. Okay, so choice 1, 2, and 3 we tend to see with dementia. Choice 4 is the one we tend to see with delirium. Remember, delirium is the one that happens acutely. It's reversible short term. Okay. Which of the following nursing questions is best directed towards assessment of a normal finding regarding physiological changes in an older adult client? 1, any difficulty driving at night? 2, are you experiencing any loss of libido? 3, do you see yourself as becoming forgetful? 4, have you had your cholesterol tested lately? And I'll give you a second to think of your answer. Okay, guys, and the correct answer is 1, any difficulty driving at night. What do we know about the older patient? Their eyesight at night, they become very sensitive to glares. And so what happens with a lot of the older patients, that glare becomes so much that they can't drive anymore, so they have to have a family member or someone else drive them. That is a normal part of aging, that they become more sensitive to the glare. Choice 2, 3, 4, none of those are normal parts of aging. Loss of libido, that is not a normal part of aging. Believe it or not, the older adult has the same interest in sex as a younger adult. Their interest in sex doesn't go away until they die, right? So the reason we may see a decrease in their libido, it may be due to medications that they're taking or a disease process, but that's not a normal part of aging. Choice 3, do you see yourself becoming forgetful? Becoming forgetful, dementia, that is not a normal part of aging. If a patient's complaining of that, that's something that needs to be investigated further. Choice 4, have you had your cholesterol tested lately? That's a good question to ask. We definitely want to ask that, but patient having high cholesterol is not a normal part of aging. That's not something we want to see. That's not something that we expect to see. That's something that needs to be investigated further. Which of the following responses by an older adult client is most reflective of a need for further education by the nurse regarding the physiological changes associated with the older adult? 1, I call a cab if I want to go out after dark. 2, I can't help worrying about becoming forgetful. 3, I have my eyes checked regularly, can't afford to fall. Or 4, I really enjoy eating a good vanilla ice cream, but I have cut way down. And the correct answer is 2. I can't help worrying about becoming forgetful. Now look at the question. The question says need for further education. So whenever you see need for further education, need for clarification, right? What they're really asking you is which one is the wrong answer. Or if it says need for follow-up teaching, that's really saying which one is the wrong one. And choice number 2 is the wrong one. That's the one you're going to have to provide education to the client. If the client says, I can't help worrying about becoming forgetful, you have to teach them that forgetting things is not a normal part of aging. That should not be something that you should expect. And if that does happen, that's something that needs to be addressed. Okay? 1, I call a cab if I want to go out after dark. That's a good thing, because remember, the older adults, they get what? They're sensitive to glares, especially at nighttime. So 1 is good. 3, I have my eyes checked regularly. I can't afford to fall. That's a good thing. These patients need to get their eyes checked every year. So them getting their eyes checked, wonderful. Choice 4, I really enjoy eating good vanilla ice cream, but I have cut way down. So they enjoy it, but they know that what? Those refined sugar, that high fat is not good for them, and they cut way down. That is also a good thing. The only thing that's not good is 2, where the patient says, I can't help worrying about becoming forgetful. So they think that because they're getting older, they're going to become forgetful, and that is not a normal part of aging, and you have to teach the patient that, okay? Which of the following statements made by a family member of a client recently diagnosed with Alzheimer's disease is most reflective of an understanding of this disease process? 1, Dad always has been a fighter. He'll fight this too. He won't give up. 2, we have an appointment with his care provider to see about medication therapy. 3, good thing we found out about this early so steps can be taken to keep it from getting worse. Or 4, it usually progresses gradually, so we're hoping it will be a while before his memory is gone. And the correct answer is 2. We have an appointment with his care provider to see about medication therapy. Now, guys, when it comes to dementia, there's no cure. Okay? There are medications, but what the medications do is slow down the progression, but there is no cure. Dementia is progressive. That means as time goes on, it's only going to get worse. So the medications don't prevent dementia, it just slows the progression down. Now let's look at our other choices. You have 1, Dad's always been a fighter. He'll beat this too. He won't give up. There's no cure. There's no fighting dementia. If you have dementia, it's only going to get worse. And I hate to be a Debbie Downer, but that's just the truth, okay? So number 1's wrong. Then you have 3, good thing we found out about this early so steps can be taken to keep it from getting worse. There is nothing that will prevent dementia from getting worse. Like I said, the meds will only slow it down, but there's nothing that will prevent it from getting worse. It's progressive. And the whole definition of progressive is getting worse as time goes on. And then you have choice 4. It usually progresses gradually, so we're hoping it'll be a while before his memory's gone. When it comes to dementia, the very first signs and symptoms of dementia is what? Memory loss. So yes, dementia happens slowly. So one of the first things you see is the memory loss, short-term memory loss, and then eventually long-term memory loss, and then loss of function. The patient forgets how to even function. They can't function. They'll see a toilet and not even recognize that it's to defecate and start drinking out of the toilet, right? So the first part of that answer was correct, that it progresses gradually. It happens slowly to something that's insidious, but the rest is wrong. Okay, you can't say that you hope, hoping it'll be a while before memory loss is gone. That's usually one of the first things to happen. So the correct answer is choice number 2. The nurse is planning client education for an older adult being prepared for discharge home after hospitalization for a cardiac problem. Which nursing action addresses the most commonly determined need for this age group? 1, suggest that he purchase an emergency in-home alert system. 2, arrange for the client to receive meals delivered to his home daily. 3, encourage the client to use compartmentalized pill storage container for his daily medications. Or 4, provide a written document describing the medications the client is currently prescribed. And the correct answer is 3, encourage the client to use compartmentalized pill storage container for his daily medication. Now, what are they talking about? They're talking about the pill box. Why is the pill box such a great idea for the older adult? It keeps them from being confused of which one to take. Those pill boxes usually have your time on it. It'll say morning, afternoon, lunch. So it helps them to be more organized. It prevents them from taking the same pill twice, right? Because remember, polypharmacy is a big issue with the older adult because they tend to have more disease processes, which means they're taking what? More medications. So that's why number 3 is the correct answer. It keeps them from overdosing, not on purpose, but accidentally. They'll forget that they took the medication, they'll take another one. So it really helps them to be more organized and not take a medication twice. Which of the following statements made by a 75-year-old client shows the best understanding of how the aging process affects the musculoskeletal system? 1, I drink milk and eat cheese to get my calcium. 2, I walk 1 mile every day to strengthen my bones. 3, I wear sensible shoes so I won't sprain an ankle. 4, at my age, I might never fully recover from a hip fracture. And the correct answer is 2, I walk 1 mile every day to strengthen my bones. So I talked about this in part 1 of this series. What does walking do? What does weight-bearing exercises do? It pushes all of the calcium that was floating in the blood, and it pushes the calcium back to the bone. So it helps the bones become stronger. All right? So that absolutely is the correct answer. So the patient walks 1 mile every day to strengthen the bones. They're walking. That walk takes about 30, maybe 45 minutes. So it's not something too strenuous. And just that act of walking helps push the calcium that was in the blood back into the bones to make the bones stronger. Now, let's look at our other choices. 1, I drink milk and eat cheese to get my calcium. That's wonderful, but that only helps the bones. Where walking, yes, like I said, it pushes calcium into the bones. But one other thing it also does, weight bearing, it helps with the muscles. You're using those muscles to exercise, so it helps both the muscles and the bones. Choice 3, I wear sensible shoes. That's wonderful. It helps prevent a fall, but it doesn't help bring that calcium back into the bones, such as weight-bearing exercises like walking does. And then choice 4, at my age, I might never fully recover from a hip fracture. That's true. At 75, a patient may never fully recover from a hip fracture. But the question they're asking us about the effects on the musculoskeletal system, and it's number 2, that walking. That patient showing that they understand the effects by saying that if I walk, it will make my bones stronger. And the correct answer, that's why, is number 2. Next question. Which statement made by an older adult would reflect the best understanding of the nutritional requirements of individuals at this developmental stage? 1, an apple a day is my motto, always has been. 2, I eat everything but just a bit of things like sweets. 3, fiber is more important than ever to my digestive system. 4, I don't need the fat, so I've taken to drinking protein shakes. And the correct answer is 2, I eat everything but just a little of sweets. Now here's why this is the answer, guys. The patient understands that they need, a well-rounded diet, right? They have to have their protein. They have to have a little bit of fat. They have to have some carbs. They understand they need a well-rounded diet. They have to have fiber. But they understand at their age, they need just a little bit of what? Sweets. So that's why it's the correct answer, because the patient's saying, I have a little bit of everything. And that's what they should do. We want them to have a well-rounded diet, but decreased sugars, especially refined sugars. Which of the following statements made by an older adult regarding sexuality would be of greatest concern for the nurse? 1. I can't speak, guys. You guys, if you've been watching my videos by now, you know I can't talk, so that's okay. Will this new medication affect my libido? 2. What can I do to help my vaginal dryness? 3. I really miss the intimacy my husband and I shared. 4. It's so nice not to have to worry about an unwanted pregnancy. And I'll give you a moment to think of your answer. The correct answer is number 4. On the part 1 of this video, I went into detail and I talked about how the aging population, the elderly, the geriatric population, they are the fastest growing STD rates here in the United States of America. Why? Because nobody's getting pregnant, so they think they don't have to use protection. Okay? So that statement, I'm so happy I don't have to worry about pregnancy. You're going to have a talk with that client and say, yes, you don't have to worry about pregnancy, but you still have to worry about STDs such as gonorrhea, chlamydia, HIV, AIDS. Okay? So the minute a patient says something like that, bells need to be going off in your head, and that's something that you need to address. Oh, let's talk about the other choices. So we have choice 1. Will this new medication affect my libido? That's a great thing that the patient's asking about that, because lots of medications do affect the libido. So it's a good thing that they're asking. 2, what can I do to help with vaginal dryness? That's a good thing that the patient's asking, because women, when they go through menopause, when that estrogen decreases, one of the side effects that we see is vaginal dryness. So it's a good thing that they're asking questions and they're seeking help for it. 3, I really miss the intimacy my husband and I shared. The patient's reaching out about them not being intimate anymore. That's a wonderful thing. And so you can explore that further with the patient. That's wonderful. And out of this list, what is a priority for you to address from this list is the fact that the patient's happy that they don't have to worry about pregnancy. You have to let them know, yeah, you don't have to worry about pregnancy, but you do need to worry about STDs. Of the following client statements made by an older adult client, which best reflects an understanding the educational materials on nutrition presented by the nurse. 1, I'll keep this literature and read it again. 2, I love rye bread. It's been good to know it's high in fiber. 3, nutrition and cooking has always been passions of mine. 4, now I can see the connection between food and my health. The correct answer is 2. I love rye bread. It's good to know it's high in fiber. 2 is the only choice out of all of these choices that not only the patient's repeating to you, they're demonstrating by what they're saying that they understand what's being told, but they gave you an example of what they're doing. Okay? Nursing Education 101, when you're teaching a patient, what do you always want? A return demonstration. If it's something that the patient can't physically show you, they have to do what? Explain it to you. How? Give examples. And this is exactly what the patient did. So that's wonderful. And that is our answer. They're showing the connection and how they're applying it, so you know that they understood that teaching. The nurse defines ageism most accurately as 1, the undervaluing of individuals based on their age. 2, perception of a person's worth based on productivity. 3, biases directed towards individuals considered aged. Or 4, discrimination based on an individual's increasing age. And guys, it's very seldom that you're going to get a question like this where basically they're just asking you for a definition. No critical thinking is involved. You either know it or you don't, right? So what is the definition of ageism? And it's for discrimination based on the patient's increasing age. People discriminating on someone just because they're older. All right, guys, and we're down to our last question, and this is a select all that applies. Remember what I taught you about select all that applies. You treat them as true or false. Don't try to group them together to make it true. By itself, does each choice is given to you by itself, can it answer the question? If it does, it's true, and if it doesn't, it's false. You get rid of it. So here's the question. The nurse is preparing to present an educational program to residents of an assisted living facility. Which technique strategies would be most appropriate for the learning needs of this age group? Select all that applies. 1. Speak in a slow but well-articulated manner. True. You want to speak in a slow, but you want to articulate your words so that the patient can hear you. Absolutely. You don't want to yell. You don't want to speak quickly. Slowly, but well articulated. True. 2. Present a variety of ideas so as to have broad appeal. False. That's not true. You want to present one idea at a time, and you don't want to present too many ideas because it's hard for a young person to keep up, much less an older person. So that's false. 3. Speak in a soft, low voice as to help the audience focus. No, if you speak in a soft voice, they're not going to be able to hear you. Okay? Now, the low pitch, you want low pitch because it's hard for older adults to hear high pitch sounds. So you want low pitch, but you don't want to speak in a soft voice. They're not going to be able to hear you. So that's false. 4. Small groups allow for more speaker-listener interaction. True. When it's a smaller group, it allows for the patient to be able to ask questions and for you to be more engaged with the group that you're teaching. 5. End the program if there are any signs of poor concentration or fatigue. True. What's the point of teaching if the patients are distracted or tired? No, you're going to end it early and then just resume another time, okay? And then 6, present the material in a fast-paced manner to keep hold of their attention. False. You want to speak slowly and you want to make sure you articulate your words. You don't want to go at a fast rate. They're not going to be able to keep up. So guys, I hope this video was helpful to you. Like I said, if you haven't watched part 1, make sure you do so. Lots of important topics on that as well. Thank you for supporting my channel, guys. Don't forget to like, subscribe below, press that notification button, and of course, share my videos with anyone you know who might benefit from them. Thank you for sharing this time with me, and I'll see you next time.